Rectus Diastasis, a Harry Potter curse or a problem we can fix with cosmetic belly surgery? Let's discuss. If you've been looking into belly contouring surgery like tummy tucks, you've probably come across the term rectus diastasis or diastasis recti or muscle separation. Well, what does all that mean? Well, it's really talking about your abdominal muscles, your six-pack abs muscles, and whether or not they've been stretched apart, forming a gap between them. That would be the diastasis, and the recti is just the rectus abdominis muscles. So this tissue between your rectus muscles has become loosened and stretched over time and has limited ability to retighten on its own, as there's no muscle in between the muscles there. This area of laxity then will allow stretching and bulging when the pressure goes up in the abdomen, like during exercise or sitting up or when you try to stand up. So why does that matter? Well, if you're going in for contouring surgery, you might want to address this, as this will help try and flatten your stomach from the side profile and will improve your figure. And if it's neglected and it's not fixed, you're not going to get as flat or as narrow a waist as you might otherwise achieve if you do fix it. So who develops a diastasis recti? Typically, it's a woman who has had multiple pregnancies where there's a growing fetus in the uterus, and it expands and stretches the abdominal cavity because it needs space to grow. And that then stretches the abdominal wall. And then, since it has limited capacity to retighten, then you might wind up with persistent bulging. However, this is not just a problem restricted to female patients. Some male patients also suffer from diastasis recti. And those patients, typically it's hereditary. Sometimes they've also had significant weight fluctuations, and this contributes to the stretching. So how do you fix it? Well, typically during a tummy tuck procedure, while you're under anesthesia, I will use permanent sutures to bring those edges of the rectus muscle back together to the midline, and that will help re-contour your abdominal wall. And this is done all under the skin. So we also have to talk about the limitations in fixing the diastasis rectus. Well, one of those is it's not addressing the muscular tone of your abdominal wall. That means we're just bringing the muscles back together, but not improving the contours of your muscles. If you want to discuss your options for cosmetic belly contouring surgery with me, give us a call today or follow us on social media and send us a line.